Well, I am super excited to be here with you guys. Strap up. We're going to be talking about narcissist subtypes and the connection to attachment theory. So, I want to really kind of do a deep dive into narcissism. Is there a particular attachment style that all narcissists have? Maybe the answer is going to surprise you, but we're also going to really get into the subtypes. Now, I have my own theories of subtypes that don't necessarily, in fact, I did sort of a search this morning on subtypes because it's constantly changing of what different subtypes are of narcissists. But I did a search and I did some chatting with Chat GPT, which is always interesting to talk to this artificial intelligence about its data combing and what it thinks. So I'm going to propose my own theories of types of narcissist subtypes. And maybe you have differ from me. Maybe you can get into, how you agree or disagree, or we can just kind of debate on what that is and why you think the way that you think, or why other people think that the way that they think. But I think the bigger question I want to first get into, and I'm going to address this at the end, so I hope that you stick around to the very end of today's live stream. We're going to go an hour, is to talk about why does subtypes matter? Should you even be concerned about what subtype of a narcissist you're involved with, or even identifying subtypes of narcissists? Is this important? Does it benefit us somehow when we're surviving these relationships? I mean, let's talk about that in the very end. So now, there's two ways for me to approach this. I can first approach it from what is a narcissist, because there's big debates about what that is. Are we overusing the label? Is it really just forms of toxicity that maybe everybody once in a while is not very kind to each other or selfish? Maybe we're lacking self-awareness. So we can discuss that. Also, attachment theory. That's another big, massive topic. What is an attachment theory? Where is it based out of? And what does it mean for you and me in a relationship? Because I think it's really, really important to understand the context of attachment theory and what that says about how you connect to other people and also how people connect to you. So I'm going to first talk about narcissist. What is a narcissist? Why does that even matter? And then let's get into attachment theory, and then I'm going to start to blend them together, put the two together, talk about subtypes of narcissists, and then I'm going to wrap it all up with talking about why this should matter to you. Like, how can you use this to better protect yourself in relationships? How can you use this to be able to navigate connections better, even to navigate maybe how you're relating to yourself and to other people? So I want to get into safety with yourself, but safety to other people. For those of you who are new to my platform, who don't know me, I'm Dr. Kerry McAvoy. I'm a retired psychologist. I have over 20 years of counseling experience in a private practice. I've been retired for a while these days, but I am current on my continuing education. I'm actually still licensed to practice, although I don't practice. But primarily these days, I just love to provide education on relationships, on all types of relationships, but particularly my passion is about narcissistically abusive relationships, because for one, this is kind of a exploding topic that's had incredible ramifications for most of us. The outcomes of individuals who get into these relationships is really poor. You're more likely to come out of a relationship with a narcissist with PTSD and to really been struggling psychologically. So I think it's important for us to understand what is a narcissist, what is a narcissistic relationship. And by the way, you can be a narcissist, you can be in a relationship with somebody who's not a narcissist and still have a narcissistically abusive relationship. Those two actually are not necessarily the same. That's not a massive like causal effect that only narcissists create narcissistic relationships. A lot of types of people, a lot of types of personality styles can cause narcissistic abuse. So let's get into what a narcissist is. It's a type of a personality disorder. Well, what's the personality disorder? That's a way to say how you define who a person is. So when you meet somebody and you start to take an appraisal of that individual, you're considering, are they outgoing or are they more reserved? Do they enjoy, are they kind of energized by being around people, or are they more energized by spending time with themselves or being solitude? Is this an individual who's basically kind of cheerful and open to experiences? Or are they kind of, closed and constricted and maybe a little more anxious or uncomfortable? You might ask yourself, to what degree is this person conscientious? Do they consider the needs of other people? Are they considerate of the rules and limitations? Or is this a person who sort of like operates out of what's best for them in that moment? These are all the things that we assess when we meet somebody. And based on that, it kind of gives us a sense of not only what to expect with a person, but also a level of like how interested we are in having a relationship with them, but also how maybe safe they make us feel. Like for example, if you're somebody around somebody who's really rigid on the way they think, and they're kind of like closed off and constricted and inflexible, and then you find they're kind of antagonistic and they like to fight with you a lot, and they don't really have a sensitivity to how you're experiencing life or the world, I wouldn't think that'd be a very easy person to have a relationship. I would find that person rather unsafe. So personality styles really tell us it's not actually styles. Let me change that. Personality qualities. These are durable, hardwired qualities that are pretty present from birth. So if anybody who's had more than one child knows that even though the DNA pool may be the same, you may have the same mother and father, but each child's going to have sort of a different mix. You might find some kids are a little more soothe themselves better, sleep through the night, or a little more easygoing. And thank you so much, guys, for that gift. You might find other kids a little more challenging. Maybe they're more sensitive. Maybe the noise in the house bother them. You might find them maybe they just really struggle to deal with certain emotions more than others. They're kind of hard baked into our personality. But then what happens in these early years, depending on a lot of variables, could be, match with the parent, could be what happened in that family, could be birth order, could be maybe some external event, maybe like an illness, could be lots of stuff. Depending on what happens in that family and that child's makeup, as well as the match between parent and child, creates a personality style. I'm sorry, I'm using that word again. Creates a personality. And so that individual then becomes who they become. And that's something that then persists pretty much through that rest of that person's life. So take, for example, I'm an introvert. Now, you probably like, you're an introvert. You don't act very introverted. I would be what I would consider an extroverted introvert. But if I take a questionnaire on that assesses extroversion to introversion, you're going to find that I'm highly introverted. I'm almost like, I'm above 90% introverted, which means that being around people on a long-term basis doesn't energize me. It's like working out really hard. I can do it. I can do it really well. I can appear very friendly. I'm certainly not shy, but it's expending energy. That's not something with practice or determination or just changing my mindset is going to change. They actually have looked at that there's neurochemicals involved that are released when I'm with people that are also not released when I'm by myself. Now, the opposite is true for extroversion. So a person who just finds themselves feeling more awake, more with it, more excited, more like up and ready to go, is because of their extroverted, they can say, I really want to learn to spend more time with myself. I want to do more solitary activities. Like even think of the pandemic. I want to learn to embrace having to like shelter at home. Well, I mean, for anybody who's an extrovert, I'm sure that was painful. For me as an introvert, that was not so painful. It was actually a welcomed experience. So those things aren't very changeable. You're not going to become a different person just because you will it. It's become who you are. So narcissism, there's a whole group of personality traits that we all vary on. And they range from things like there's a dependent personality disorder. There's also histrionic, schizoid. I'm just trying to, like, off the top of my head, think of the other types we don't tend to talk about, but there's a whole list of personality disorders. But there's a group of them called cluster B. And cluster B is sort of seen as the group that is antagonistic. The whole group in general tends to respond to relationships from an antagonistic perspective. And the makeup of that group includes narcissistic personality disorder, histrionic personality disorder, borderline personality disorder, and antisocial personality disorder. That would be, I would say, paranoid personality disorder probably kind of has one foot in there, but they're not technically a cluster B. But that group, by their nature of hard wiring and early childhood experiences, and please hear me, I'm not saying trauma. Trauma is a catch-all way for toxic people to manipulate their history as an excuse for bad behavior. Because 80% of us or more probably definitely more. If you look at the whole world as a whole, more than 80% of us have had trauma. I actually heard that come out of the mouth of Dr. Vander Kolk in person. I got to hear him say that in person. And I believe it, based on my 20 years experience as a psychologist, after sitting with all the people that I have, everybody's had something terrible that's happened at one point or another in their life. But so it's not essentially trauma, but it's a whole cluster of things that happen that causes narcissism. But narcissism specifically is a cluster of 9 symptoms, and based on the Diagnostic Statistical Manual, which is what every clinician uses to diagnose disorders, you have to have 5 out of the 9. I know I'm not going to be able to list all 9 off the top of my head, but they include things like excessive self-entitled focus, jealousy, exploitive behavior, possibly being deceptive, lack of empathy, struggle connecting with other people. So the big criteria, if you want to think of them sort of like a global areas of difficulty, are they struggle with intimacy, they struggle with empathy, they have difficulty with self-determination, and there's something kind of inherently problematic with their sense of identity. So if you kind of think of those big, huge main areas, that's a really great way to think of all people. How well do they see themselves and are able to be self-reflective and to be proactive and to grow and change? How well can they connect with other people and grow connections and intimacy and build relationship with other people? How well are they able to be mindful of the feelings of other people and take that consideration into consideration when they make decisions about their behavior? And do they have that ability to be self-determined? Can they set goals reasonably and follow those goals out to their outcome, to a positive outcome? People who have difficulty with narcissism have a certain problem in these 4 areas, just like every other personality disorder also has problems in these 4 areas, but they look different. For each personality disorder, there's a kind of a different presentation of these 4 areas. So in the narcissist arena, they are great at making first impressions. They're all about confidence and charm and almost a kind of a false bravado, sort of this bigger than life way of taking up the stage. Or with the covert narcissist, also known as the vulnerable narcissist, that's much of a victimhood. They kind of lead with their victimhood. It's all about how life's unfair. So in both directions of the narcissist, there's sort of this excessive preoccupation with themselves and how they sort of sit themselves on the floor of the world, how they sort of interact with the world. All narcissists struggle with creating intimate connections. They, like I said, they make great first impressions, but they don't commit to other people. They don't collaborate. They don't work towards the common good of a relationship. They always work towards the common good of themselves. Narcissists as a whole, regardless of the subtype, have problem with empathy. They struggle with understanding. It's not understanding your feelings, because a lot of them can imagine what you're feeling and how you're feeling, because that's how they're so good at manipulation. But they really struggle having concern about your feelings. They have really struggle having concerns about the impact of them and their behavior and the consequences of their behavior on you. They don't really have a huge connection with that. There's sort of this disconnection around the way in which they impact you. And all narcissists struggle with some level of self-determination. Now, interestingly enough, the grandiose narcissist tends to be more successful. They tend to follow through with whatever they want in life and to see it to its goal. But whereas the vulnerable or the covert narcissist tends to be sort of the failure to launch. They tend to be sort of what some people will refer to as a collapsed narcissist. Like they have really grand plans and great hopes. If someone would just believe in them, and yet if you ask them for a really detailed history, as if you could get that and have it being honest, you'd find out that they have had many attempts, but they just never seem to implement any of them. They're the person that says if they could just get someone to sort of buy into their patent on whatever new invention, they would make $1 million. And yet when you hear the idea, it's either half-baked or there's no really good, follow through on the plan, or they get so impulsive and so selfish, they end up squandering all the resources they gathered in some useless or bad direction. So that doesn't end up going in the direction that they hope. So yeah, that those are the ways to sort of conceptualize narcissism. So let's talk about the subtypes. Most people these days in 2024, this is the subtypes you're going to see talked or discussed online. It's the grandiose, the covert, or the vulnerable narcissist is sort of, they use often similar words, but they're describing the same type. The antagonistic narcissist, the malignant, the sexual or somatic, and the communal. Those are the subtypes that generally, if you were to go out there and do a search on YouTube or you do a search on just Google in general, those are the types that are going to come up right now. I, however, think that this is the subtypes I like. This is my takeaway. I think there is definitely a lot of evidence for a grandiose type. We can talk about what is that and how do they look. Definitely, there's a lot of evidence of a vulnerable or covert narcissist. Just that's another powerful subtype that trips a lot of us up. And definitely, I've spotted and understand the communal narcissist as well, which is also known as the hero narcissist. We can talk about that subtype. But I disagree on the I missed one, the malignant. And there's the malignant narcissist, which sometimes is it's a cross between the antisocial personality disorder mixed with narcissism, mixed with Machiavellianism, which also sometimes called the dark triad personality. Yes, there's definitely a malignant narcissist, but I disagree. I have problems with the antagonistic, and I have problems with the somatic and sexual, because I think the somatic and sexual are two different types. And we can talk about why that is and how those types are different. And I also think that there is another type that we don't identify, but we know, if once I say it, you're gonna like, oh yeah, I've met that type. I think there's another type out there that we don't talk about, and that's the intellectual narcissist. So I'd like to propose, this is Kerry McAvoy's subtypes. Please hear me. It's just my theory on subtypes. I think there's the grandiose type, the vulnerable or covert narcissist, the somatic narcissist, the sexual narcissist, the malignant narcissist, and the intellectual narcissist. So let's talk about my 6 subtypes and what they look like so that you can get better at recognizing them when you meet them in the wild. Okay, the grandiose is the easiest to spot because they're the life of the party. You walk in, they're usually in the center of the room, and they're regaling everybody of their latest story and adventure. Whatever they do and whatever they have is the best and the right. They're going to try to convince you need to get in on that. I once knew that this person I was around would say, you got really nice new pair of shoes. Oh yes, and this is where you get them. You need to get a pair just like it. I mean, they're always trying to sell you on their version of life and why their version is the best. They're the person who just has a lot of bravado and just sort of bowls you over with confidence. Their confidence, it's sometimes misplaced because they don't have a good self-reflection. So sometimes they're the person who thinks they're the wisest in the room, and yet you know that somebody in the corner probably has a whole lot of more education and experience, but they just sort of believe in themselves. They believe that they're all that and that they're better than anything. And you know, the puzzling part of this to me is how often this person's successful, how much they're bluffing, which in their minds they're not bluffing. They believe what they're saying. They know, it may be paper thin, whatever they're standing on, but they believe that paper is concrete and they'll stand on it. And you might around them look at that and think, it's just paper thin. How can you take that? I think, for example, take American Idol. I know it's kind of a dated example, but how many times have you watched those auditions and somebody comes in who clearly can't sing? I mean, it's probably the cows are mooing in the background, like begging this person to please just stop singing. And yet they think that they're they deserve to be on this show, and they're puzzled when they get sent home. That's an example of sometimes how just kind of tone deaf, I mean, literally tone deaf these people can be about that, the fact that they're not all that. But it's amazing to me, the number of them that get people to believe in them and to buy into their wisdom. It's just because sometimes they're smart enough and they've honed this skill enough that they know just the right line to convince you in what they say. But so that's the grandiose type. It's just loud and proud and very confident, and generally they're likable. That's the other thing, is that we find them attractive because I mean, there's been studies on the impact of confidence, and we find confidence really very attractive psychologically. So we're drawn to that bravado and just, grandiosity. Okay, so that's the grandiose type. The covert narcissist, or the vulnerable narcissist, is equally as bold, but it's not in the direction of, see me. It's more poor me. So they're either the biggest victim or the biggest martyr. You'll hear them either whining and moaning about how nothing ever turns out the way they want, or no one understands how hard they've had life, or life's been so unfair and has given them so many bad turns, or they'll go on and about all that they've sacrificed, just how much they do a lot of guilt tripping, how much they've done for you, how far they've gone out of their way for you, the risks they've taken for you. So, but usually this is done in an introverted way, which is why we miss it. We end up thinking the softness of it, the fact that it's comes off cross kind of with sympathetic. We mistaken that, thinking that this person is empathic and sensitive, because it sounds self-reflective, but it actually is not. Because if you pause long enough and ask them, why did these things not work out, you'll find out that they've externalized the blame. It's always somebody else's fault. It's not their fault. They weren't given the right chances, or they didn't meet the right people, or when they did meet the right people, they didn't give them the right resources, or or they didn't have all the right resources. They're going to always blame elsewhere. It's always outside of themselves. If you ask them, well, what could you have done differently, or what did you do, you're not going to hear any slowing down to really reflect on their problems. It's just, and if they do, it's really thin. Again, it's very very superficial and not well thought out. It'll feel scripted. It won't feel like this person spent a lot of time considering what went wrong. They're just literally offloading the responsibility to everybody around them. The other thing about the vulnerable narcissist, or the covert narcissist, is they're extremely passive aggressive. They're very defensive. Now, all narcissists are defensive, but the way they're defensive is different. So the grandiose narcissist is just going to be rejection, just a rebuff. Maybe they'll flip it around and make you feel stupid and attack you for even putting them on the spot. But the covert narcissist is going to remember that you did that. And maybe nothing happens in the moment, but they're going to make sure down the road that they get even with you. They're not going to forget what you did. So they're going to keep scores a lot. And I think the other thing about covert narcissists that throws us so off is that I think it's that they're so reserved that we just really we're surprised that they seem reflective, like they're empathic. And they may even go to some efforts that look like they're expressing emotions, and they do. They are amazingly good in their ability to be sad and show regret and all sorts of emotions that you just think narcissists don't do. And the problem is that you don't realize, though, that it's in service of them. It's not in service of the relationship. It's not service in you. It's in service in them. It's to garner more of your sympathy, maybe to draw you in and gain more trust from you. But it's the purpose of it. It serves them. They share these emotions intentionally to serve them, not to serve the intimacy between the two of you, but to serve them. So really watch out for that, because I know for me, I would say my ex is a covert narcissist. It really tripped me up when I saw that. I think if you ask yourself, do they get heartbroken over things that happen to other people? And you're going to say, no, they actually don't. They're kind of callous about that. Do they show an effort to repair the damage between you and them? No, they don't. And if you were to put them on the spot, how well does that go? If there's some kind of confrontation, you're going to see that goes really poorly as well. That's universally with all narcissists subtype. Okay, let's jump into the communal. The communal is also in the past has been talked or spoken of as the hero. The communal is really hard to see. I have a feeling that communals often are women, not always, but I think that's, if we were to look at the genders, there's probably predominant of women are more likely to be this. And by the way, I think women, there are a lot of covert narcissists that are women as well. A lot of men too. I'm not saying men are not covert. There certainly are. I've met them, but communal, I think, is an easier one for women just because it kind of like lines up with femininity, which is it's the do-gooder. And so this is the person sort of the echelon of of your community. This is the person who's probably serves on boards. They're the one signing up for PTA and heading up all the fundraiser for the PTA. They're the one that probably is organizing all the parties for their child's classroom. I'm right now watching, you guys know I watch my TV and I love my series. I'm watching a new series called The Perfect Couple. It's new, it's on the top 10 of Netflix, and it's the cast include, I think, Liev Schreiber, maybe saying his name wrong. And then he was for example, the X-Men, he always was the villain in the X-Men. And it also features Nicole Kidman. Nicole Kidman, who plays the character Greer. Greer is a communal, but also covert. I would say she has both features of covert narcissist, as well as she's also a communal narcissist. She's an author. She's out there doing good things for society. She seems to know everybody. She's smoozing. But if you really could stand back and look at what her motivation is, it's to advance herself. It's to build her own credibility. It's not really to improve her community. You know, she may know everybody on that. They're on Nantucket. That's where it's it's set. That's the setting of the story. She may never know everybody on Nantucket, but that doesn't mean she cares about what happens. She just cares about how it affects her, what happens on Nantucket. So think about the communal narcissist as a person who's really out front, seeming to champion the good of some well-being, you know. By the way, here's a sobering thought, a very sobering thought. It is proposed that any big movement, I don't care what movement you say, Me Too, Black Lives Matters, any big movement is always vulnerable for narcissists to insinuate themselves into it and try to take over and make it about their agenda instead of the agenda of the community or the agenda of the good of the original intenders. So always watch out for that. If you're doing something that's really big, you're part of an advocacy of some kind where there's a lot of social awareness and there's power starting to happen around that advocacy, be really careful about narcissists because they're attracted to power. Wherever power is at, they're attracted to it. So that's also for you to be mindful that when you meet healthcare providers, when you meet people with a lot of power in the legal realm, or any kind, even in the spiritual realm, if there's a lot of power and authority to that position, then there's going to be a likelihood of more narcissistic people in those positions of power and authority. They're very attracted to that. Just a side note. So that's the communal. Okay. The next one is the malignant narcissist. That is the mix of the antisocial personality disorder with the narcissistic personality disorder. And we also want to throw in a dash of Machiavellianism, which is really out of a book. It was a tale of a very sadistic, vindictive, charming person who then exploited people. So we're really talking about a very charming, sadistic person who's good at wooing people and seducing them into doing his will or her will. But the malignant narcissist is destructive. Think of everything that I've said and just turn it up a lot. They're like the worst characteristics on steroid. I think the best personality characteristic, thank you so much, best personality characterization of this would be, if you ever watch Succession, I would say that Logan was the perfect example of a malignant narcissist. He destroyed everyone close to him, just everyone. I would say his daughter had a lot of malignant narcissism as well, but she also probably had some covert narcissism thrown in. I would say Tom, her husband, was a good covert narcissist. He was very dangerous that way. So, but pay attention to that. They're more likely to publicly just trash you, insult you, make you feel small. They're the person that when you're around them, they're bigger than life, but you're very intimidated, very afraid of them. You feel a lot of fear. So be careful with that kind of individual. Yeah, somebody just Graceful Oaks just was talking about cult leader. Cult leaders, yeah, they're also often cult leaders are they tend to be covert narcissists with a lot of malignant narcissistic tendencies. They tend to be a blend, and definitely they're on steroids. They're at the far end. So I would say that they're severe at whatever they do. So I agree with you that that's the type. So watch out for the malignant. They're not hard to spot. We just would like to avoid them, but unfortunately, often, like I said, are attracted to positions of power. So we often can't get around them. But boy, they're scary when we meet them. And when you meet them, you know it. You know that you're in a presence of somebody who's really, really intimidating you. Then this is where we start to get into tricky territory because this is Kerry's theory, okay? This is Kerry's theory. I think there's such a thing as a somatic narcissist. And I'm going to describe that as different than a sexual narcissist. Both of them use their body and their health and well-being to attract people. But I think it's sorry, my computer keeps going to sleep, which I don't like that because it changes my lighting. So I keep hitting it and trying to turn it back on. I'm sure that's causing a fluctuation in the lighting on my face, and I apologize for that. So to me, I'm going to describe the somatic narcissist. The somatic narcissist is the person who is excessively aware of their body and excessively aware of their health. Now, there's kind of two big presentations of this that I've actually seen in life. There's the one is a person who's sort of like the excessive gym bro who's sort of sculpting their body into a particular way, and they're just excessively focused on it. It's their life. Everything about their health is their life. It's their identity. And they are sort of like competitive about it and obnoxious about it. It's just this sort of this, it is the way that, if you talk to them about anything, it's going to be about clean living or the latest weight training, or if it's a woman, you're going to hear them about, again, more probably clean eating, but it's just this excessiveness. Women, you might see more of a use of plastic surgery. So they're going to be this excessive focus on perfecting themselves and perfecting the way that they present themselves as if they're almost like their body's a machine. But here's another way it can present. You may meet people who do that with their illnesses. I think that's where those who have Munchausen or Munchausen by proxy come in. I think they have a lot of narcissistic traits as well, maybe are narcissists as well. So there can be equal preoccupation with my latest health crisis or my latest medical procedure or how my treatments are going or even what kind of treatments. I've seen family members of this type get dragged into where they're spending excessive money on extreme, rare, not researched procedures in a pursuit of something that may be very costly in the big picture to the family dynamics, maybe even to the relationship. But there's this excessive focus on health, on body and body image. And like I said, it could be towards sickness, towards treatment, but it also could be towards perfection and beauty or some sort of extreme like form of that in some way. I think that's a somatic narcissist. I think a lot of us have met them, and there are a lot of them around us. Then I think there's the sexual narcissist, and that is the person who's, think of the Don Juan or the siren, or the sort of the person who's all about seducing, attracting, pursuing for their own pleasure the experiences with other people. And so there's this excessive focus on over sexualization of relationships and kind of as a consumerism when it comes to intimacy. And again, everything's about that. It's all about that kind of experience. They're literally consuming people in an effort to pursue that kind of experience. I'd say my ex errs in that direction. I have no idea the number of partners he's had. It's a shocking number. But when you start to hear that kind of exploitation of people, pursuing and grooming and like this predatory consumption of people instead of intimacy. They're not looking for intimacy. They're looking for, it's almost like a connoisseur of a particular type of experience. I think that's another type of a narcissism that we should be really aware of and be careful of. And then the last one, and this is something ChatGPT and I got into, and I agree. I thought ChatGPT was wise on this one. It suggested that we're missing a type called the intellectual type. And when it mentioned that, suddenly I thought of examples of the intellectual type. This is the person who would love to beat you down and show that they know more. In fact, they're the person who will often meet experts in whatever their topic and then have to show that person they know more, even though, again, I'm going to use the example. Maybe their knowledge of the topic is only paper thin, but they're going to act like it's 20 feet deep. I'll never forget years ago back in college. I was a freshman in college, and I wanted to impress this senior, and I don't know why I cared, but I did. They were sitting at a cafeteria table, and they're all talking, and he used a word I didn't know, and I thought that it would be a compliment if I asked him what the definition of that word was. And he looked at me in front of everybody and said, "You go look it up." Now that's an example of, now am he the narcissist? No, I'm not saying he's a narcissist, but that's an example of a narcissist, something that an intellectual narcissist would do. They just seem to have the last word. They seem to know more. I can't tell you the number of people who will come on my page and know that I have a PhD in psychology, know that I'm active in continuing education, and will, because of their consumption of YouTube or maybe some book that they've read recently, that they seem to think that they know more than I do. Now, I'm not saying they might not. They might. But think of what that's suggesting. It's sort of it's a lack of reflection of, it's certainly a lack of respect of me, and it's a lack of reflection of the knowledge base of that goes into psychology, and it's kind of a callous treatment. It's not a very sensitive interaction between that person and myself, and it puts me in a one down position, and they're definitely controlling the narrative and controlling the conversation, and it puts me defensive. It makes me defensive, and I end up feeling like I don't really have to defend what I know about psychology. I can just sort of like leave it be. But pay attention to that dynamic. Say that you've done, let's say you're a plumber and you've done plumbing for 40 years. You've seen how pipes have changed. You've worked with PVC. You know a lot about copper, maybe even around the day when they've used other types of lead for plumbing. You've learned about sealants. You know a whole lot about it. You got some whippersnapper who comes in and tells you that you're sealing the joint wrong. You're like, I've been sealing this joint for years. Why are you coming in and telling me how to do that? That to me is an example of an intellectual narcissist. It's like missing the whole context, missing you as a person. There's certainly no respecting your dignity and the education experience that you have. So pay attention to someone who sort of needs to one-up you and be competitive around showing you that they know more and know better. Because here's the bottom line in around relationships. Humility is a sign of intellectual and emotional strength. The ability to see that other people have something that you can gain from other people. If you show a lack of ability to see that, you're really reflecting something about, you're really reflecting your inability to see that there's something to take from every interaction that you meet. So those are the subtypes, okay? Now, I want to stop for a second, and I'm going to make a big shift and talk about attachment theory, and then I'm going to come back, I'm also watching my time, and come back and tie these together, and then tie it into why it matters to you. So attachment theory came about right after World War I and II, and it came through an observation that two big researchers had. They actually, I don't know if they necessarily worked together, but the two big names, I'd have to go look that up. I always like to be stickler on facts to the degree I can, but they're Bowlby and Ainsworth, two big researchers. John Bowlby and I don't remember, Mary Ainsworth, I don't remember Ainsworth's first name, is a woman. They noticed some interesting trends and patterns in orphanages. It was really where they observed it, and in the care of infants. They noticed when there was a large group of babies that some babies survived and some didn't. And they started to pay attention to what caused the survival of some over others. And then that led to a huge, massive studies that kind of happened around the time that I was born, which I know I'm dating myself, in the 60s and 70s, and maybe, again, I don't know the exact years that they did these studies, but they started videotaping infants with their moms, because at the time, if you think of that era, women were the primary caregivers. So it wasn't that they said men weren't caregivers, it was just that men typically weren't at home. So these studies occurred between women, but I really think they can apply to cross-gender between infants and the caregiver. And they started to notice that there were 4 styles of attachment. That some infants, when the mom left the room and then came back, or if a stranger came into the room when mom is there, they did this whole kind of series of tests, and they had one where they kind of crawled over what appeared to be a visual cliff. It was actually plexiglass, but it looked like it dropped off and the baby was going to fall. They noticed whether baby would still crawl over that lip, that edge, if mom urged the infant. They did all these studies of various scenarios of infants and noticed that there were 4 general big types of attachments that infants had with their primary caregiver. They are attached, securely attached, anxious preoccupied attached, avoidant, fearful avoidant, or disorganized. Okay, so these types, let's take the 3 problem ones, and then I'll talk about let me talk about the secure one first. The babies that were secure were able to take risks. They were able to explore the room. They were soothed. If mom left the room and they got distressed, they were soothed by her easily. They connected well with mom when she came back. They just showed a lot of adaptability, and they showed the ability to sort of focus on things around them instead of managing the relationship. That's the big thing I want you to hear. They were able to not worry about the relationship and focus on just developing and exploring their environment. The other 3 types did some form of management of the relationship. And these are infants. I'm talking about infants, not toddlers, not preschoolers, not school age kids. I'm talking infants. So this is how fast we are able to learn how safe, how much trust we have in these primary relationships. They noticed the infants with some moms that when she was present or left the room or came back, that they felt preoccupied with her. They were anxious, like they fussed and nurtured her. They sort of checked in with her. They pursued her. They showed a lot of activity to pursue her in an anxious way. So they acted like the relationship was precarious and not safe. They had to keep her involved. Then there were some infants, and this is the avoidant type, that disregarded mom, kind of seemed to avoid her, almost act like she's not in the room, kind of seemed withdrawn from her, like they gave up on the relationship. They didn't pursue the relationship. They kind of seemed passive about her, or just, distant, avoidant, as if that's what I think. I think they gave up. They just felt like it wasn't worth the effort, so they felt like they're kind of on their own. They became hyper independent. Then there was some kids that constantly watched the parent and seemed to never quite know what state to expect the parent was in. And they seemed to be what they called more disorganized, meaning like there wasn't a predominant style. They seemed to fluctuate between being anxious and being avoidant. And they noticed with those kids, those parents seemed to be very inconsistent in how they showed up. Sometimes the parent came through and was great and really provided a lot of what that kid needed. Other times it was really hit and miss, and maybe the parent wasn't so effective. Maybe the parent was absent. The child just learned that you couldn't trust that parent, that you had to really assess where that parent's state was, and they became hyper vigilant. That was the big characteristic of that one, is hyper vigilance. So the first one was the anxious group is really like overworked and trying to do a lot of caretaking. The avoidant group seemed to be withdrawn and almost like they've given up and they just found it not worth the effort. And the disorganized group seemed to sort of believe that they had to stay hyper vigilant because they never knew what to expect. So is there a connection between narcissism and attachment styles? Now, I want you to hear me, okay? Please do never come back to me and said I said this, because I didn't say this. There is not one type of attachment that's consistently attached to a type of narcissism. Let me say that again, because I don't know if I'm clear. You cannot predict based on attachment style what type of narcissist that you have, because people always break the pattern. There's always pattern disruptions. So please hear me that just because you're in a relationship with a covert narcissist doesn't mean you have an anxiously attached partner. But there is a relationship, there is a correlation between covert or vulnerable narcissists tend to be more anxiously attached Grandiose narcissists tend to be more avoidantly attached, and malignant narcissists tend to be more disorganized attached. But a lot of us are disorganized in our attachment. A lot of us are anxiously attached, and a lot of us are avoidant, and that does not mean that we're narcissistic. Those are just the ways in which those groups overlap. They just happen to overlap that way. Now, let's talk about why any of this matters, and then I can take your questions, because right now I haven't, if you notice, my glasses are off, which means I can't read most of your comments very well, especially on TikTok. I'm gonna have a hard time seeing your comments. Why does this matter? Well, it matters because I think understanding that personality disorders is a permanent personality characteristics, it helps you know whether or not to invest in trying to save this relationship. A lot of us try to save ourselves by saving the relationship. We put our safety in the context of the relationship. If you know you're in somebody who's pretty hardwired the way that they are, and there's gonna be minimal changes, and this person's not empathic, not invested, they're only invested in themselves, that they really have a hard time seeing you and caring about you, it helps you to become more realistic about the opportunity of this relationship to be savable. I think the other thing that's really helpful about all of this is it gives you more ways to identify that that narcissism is highly complex, that this is not just one thing with one presentation and you can approach it like a cookie cutter. You can't. There's going to be subtypes and various like mixes of types, and even within cluster B there are subtypes. I know one of the recent questions somebody asked me in person was, could they have a partner who had bipolar disorder, borderline personality disorder, and narcissistic personality disorder? And the answer is yes. They can be all, and they can be depressed on top of it. So just because you have one disorder, please hear me, that doesn't lock that person out of having other problems and other difficulties. That humanity is as varied as our fingerprints, as varied as the snowflakes that we see coming here this winter. There's so many different presentations, and I just want you to get used to seeing that back to that big four categories: problems with intimacy, problems with identity, problems with empathy, problems with self-direction. As long as you see these problems, then that's an indication that you have somebody who's struggling. And we need to get better at recognizing that to help us recognize that we've met somebody who's not very healthy for us. Like, say, for example, somebody just gave me I heard of, I'm on I don't know if you may have not heard, because you might not be in this forum, but there is a woman out there by the name of Jenny Young. I know I mentioned her more than once before. She is a PhD in English, and she loves to study critical discourse, and she looks at rhetorical discourse or rhetorical studies, like how we use words. She loves to use dating profiles as a great example. So say you have somebody who just like insists, they send you an inappropriate picture, or they call you by an endearment and you have no relationship. Just the nature of that suggests this is a person who doesn't understand that trust needs to build, that you're essentially are strangers, that this is a boundary breach. They're crossing boundaries. They're not being sensitive to what that may mean to you and how that comes across to you. It shows us a lack of self-reflection and a lack of empathy. We need to get better at recognizing that. I was listening to the Diary of CEO on YouTube, and it had a professor who is an evolutionary theorist, and he was talking about how many times he gets stopped on the street and people will hold him up with while he has his family, his kids, young kids, and his wife there to talk about some issue that they want to talk to him at length, maybe for 30 minutes. And there's this lack of sensitivity of that they're holding him up. This is an intrusion of his time, that it's a disruption to his life, and that it's probably they haven't asked for permission. When we see that type of obtuseness and lack of consideration and lack of respect, we need to get better at saying to ourselves, this is not a healthy person. This is not a person that sees you in your personhood and is respectful of that. So I hope today, by just kind of talking about the subtypes, that maybe you have a little more information about them. Maybe you like my 6 types, maybe you don't. But certainly I would love to see that this helps take you a step further at getting better at protecting yourself. Because roughly, and I know this is alarming, I know every time I say this, people are shocked. Roughly, when you add the histrionic, borderline personality disorders, the narcissistic personality disorders, and the antisocial personality personality disorders together, this roughly 1 in 5 people that you meet have a problem. Roughly 1 in 5. 20% of the world out there is not very healthy. And I know I told you that years and years ago, I asked a colleague of mine that I highly respected, who had had a lot more years of experience than I had, how much of the world's safe? How much of the world's healthy? And he said less than 10%. So we need to be a little more on our guard and anticipate that there's just a lot of people who are obtuse and not sensitive, and that we need to be proactive about that, protective of ourselves. Okay, I'm putting my glasses on so I can see what you guys have to say. Yeah, 1 in 5, Bella. I know, isn't that shocking? Here's the other thing about I'm reading the constant ads on YouTube. Sorry about that, Mixed Fee. Sorry about that. It's sort of a necessary hassle. You know what I'm saying? But here's another thing about attachment theories that I forgot to say that I really wanted to add that I love. Attachment theory, by the way, can change. Thank you, Gray Rock is Cooking. You're right on the same mind thought as I had. Yeah, I was a part of a large study. I was a subject in a very large study when it went on for 2 years. It was a longitudinal study at attachment styles. And they were looking at what was going on in my life and the changes in my personality characteristics, and also my attachment style. And interestingly enough, they gave me the grid so I could see how it moved around. And the period of time that they studied me happened to be the period of time that my late husband died. So as I was becoming a widow and adjusting to widowhood, that whole period of time for 2 years, they followed me on a 6-week basis and asked me to take these repeat tests. And I still have access to the outcome. It was fascinating. What they showed was that attachment styles vary from person to person. So they asked me, like, how attached was to each of my parents? How attached was I to any romantic figure in my life? How attached was I to my closest relationship, my closest friends? And you could see, based upon how I was doing and what was happening in my life, you could see it kind of change. So I want to tell you that you can have multiple attachment styles. You could have somebody in your life where you don't feel very safe. Maybe this person is kind of intrusive. You have to feel like you have to be kind of withdrawn. You can have a fearful avoidance attachment style with them. You might have somebody else in your life that you feel a little unsafe with. Maybe they kind of activate you and make you feel anxious. You can have more of an attachment style of anxious, preoccupied attachment style with them. And maybe, but on the most basis, maybe most often, you feel pretty in yourself, pretty centered. You can then also have a secure attachment. So yeah, somebody just asked if I do counseling. I have kind of changed what I'm offering. So I want to let you know what I'm offering. Thanks for asking. I don't take straight on clients, like one-on-one long-term clients, but I do take in through my club membership, the top tier called the VIP support. I see people monthly, once a month, as well as they then get weekly group coaching through the community, and then full access to me through chat, as well as full access to the community. So there is an opportunity for those who are looking for kind of like a lot of support, and maybe just for a brief period of time, but if you're really wanting kind of like an intensive, kind of more exclusive experience, you can certainly have monthly consultations with me, as well as group support, group lives, and then also community chat. So that's how I organize my one-on-ones in that way. All right, other questions for me today about subtypes, about narcissists, about narcissistic abuse, anything related to that. So Kevin wants to know, why are psychiatrists and psychologists all missing the opportunity to talk about society? I guess I'm wondering, you're talking about the connection or the intersection between capitalism, democracy, and narcissism, or about mental health. That's kind of interesting. I think it varies from you have to be an expert in that. Those are big topics, Kevin. I mean, to be like culturally relevant, to know what's happening in the world, and then to have thought about that from a theoretical standpoint, that's a really big ask. I think that's why you're finding a lot of people are doing it. It's just because it's such a big study. Yeah, I love, little guru, that you know a lot about psychology, but you go in with a humble attitude. I do too. I have seen, I've had a lot of therapy in my life, and if you were to see who I had therapy with, I've benefited from coaches, I've benefited from social workers, and I've benefited from psychologists. I've never seen a psychiatrist. Not that I wouldn't, it's just that I haven't had a need for medication, but to me, it's not so much about the level of education, but rather about the style of whether or not I think the treatment is effective and this person shows a lot of authority and has good outcomes. To me, that's way more important than just the person's degree. I think there's people with degrees that are dangerous. I also think there are people with advanced degrees that are extremely incredible and do a fantastic job. I think it comes down to you have to know the individual and know whether or not they have a specialty in the area that you want. So Graceful Oak Fibers asks, talk more about the intellectual narcissist. Mine's self-righteous, intellectual, moral, passive-aggressive. He's kept us from having a permanent house and constantly is moving us from hotel to hotel. I think that's a great, you just described a lot of great characteristics that would definitely define a intellectual narcissist. That self-righteousness, yeah, thank you for bringing that word up. I like that. That's a great word. I do agree that some types of narcissists tend to be more self-righteous than others. I would say the Grandiose maybe is, I don't think they're always self-righteous, the Grandiose. They just believe in whatever they believe. So whatever product or whatever they're doing is the best product. Everybody needs to be doing whatever it is that they're doing. But you're right, there's those that are highly moralistic, very moralistic. And that makes sense. I think the intellectual probably, see, there's a rigidity. You're going to notice two big qualities, inflexibility and rigidity. They're not flexible and they're highly rigid, but how it presents across all the subtypes vary. So let me give you an example. A grandiose narcissist's inflexibility would be whatever they're doing is the best. So whatever shoes they're wearing is, if they wear Birkenstocks, then Birkenstocks is the only shoes that anybody should be wearing. You just don't see a lot of flexibility around that. And the rigidity may be in the inability to see that there are other options. Now, with a vulnerable narcissist, the rigidity and inflexibility is about the fact that the world has shit on them in their life and that they're the perfect victim or the perfect martyr, and that there's this lack of recognition of their value and respect for them. You're going to just see this rigid persistence to that story. On the sexual narcissist, you're going to see the rigidity and inflexibility around the way that they just do not consider other people's needs and the fact that they really believe that they're the best at whatever they're at. So I agree with you. I think that's a fascinating way to think about it. And I would say, yeah, that probably is more of a characteristic of a intellectual narcissist or antagonistic narcissist. I know that's the other subtype that people talk about, but in my mind, I struggle with the antagonistic narcissist because it gets encapsulated with the malignant narcissist, and malignant is highly antagonistic. Again, if you ever watch Succession and watch Logan Roy, he takes on everybody. He battles his board. He battles his kids. He can't maintain a relationship with anybody. Even the supposed woman in his life he's supposedly, having a relationship with, he's battling her. He battles everybody. So I just don't see the difference between an antagonistic narcissist and a malignant. To me, they're so close that just doesn't really make a lot of big difference. Can I discuss the aggressive or rage driving, please? Yeah. Do you know, Lisa, that they've done studies on that and they found that narcissists have more accidents? They are indeed more dangerous. There is a connection to that. Now, again, please don't go backwards. Yeah, don't go backwards. What I mean by that, don't think that because someone's rage driving or has road rage that they're a narcissist. I'm not saying that. Not every person who has road rage is narcissistic, but I do think that narcissists are more likely to have road rage or to have problems driving because the same qualities that make them lousy at everything else makes them lousy at driving. They're entitled. They think they own the road. They think the person who's ahead of them or behind them should not be in a way or impact them in any kind of negativity. They don't have any awareness of how they impact other people on the road because they don't have good self-reflection or empathy. So yeah, you just see this callousness. And here's the other thing, and it certainly happened with me. I experienced this. They like to make their passengers feel afraid. It's a great method of control. So here you're in a bad moment with this individual and things are not going well and you want to really show them up and take control of the situation. Drive scary, drive aggressively, start doing fast stops and fast starts, try to get too close to other people. It's a form of sadism, and It's a great way to shut you down, control you, and put you in your place. And it sends you an indirect message, by the way. It's the same message that you get when someone throws something near you and hits the wall but doesn't hit you, but you know it could have hit you. The message is, this could be you next time. I could do this to you. You don't matter to me. Exactly. My life, your life is in my hands. Exactly. So that is a form of sadism. I would be really, really watchful for that. What I found is that here's some words of advice, because I know that I gave a lot of content today, a lot of content. I really didn't do a whole lot of talking. By the way, I have so much to offer, guys, as far as support, community support. I've got a new launch of how to halt post-separation abuse called New Powerful You. I'm launching another group because the Healing Strong went over so well. If you're struggling to heal, there's Healing Strong. So there's so much out there for you guys to check out. I do try to put this in my show notes so that you can guys find it. But if you're looking for more one-on-one, more close work, please check out my resources and offerings. But I want to make this suggestion about all of this. Couple pieces of advice. When you realize you're in a relationship with someone who's narcissistic, whether it's a friend, loved one, relative, partner, family member, whoever, the first thing you can do is withdraw your attention and become emotionally detached. Detach yourself from needing, depending, and looking to this person for resources, help, and validation. Start to remove yourself from needing this person. Become emotionally detached. I know that's hard because many times they've developed a trauma bond with us so that we feel heavily invested in keeping up with how they're doing and feeling, and we're always checking in and we're always aware of them, and we're managing the life, trying to keep it as calm as possible. I get that. But start to psychologically, emotionally withdraw so that you are less vulnerable psychologically to this individual. Then the second best thing you guys can do is start to build in additional supports in your relationship outside this relationship. Start to reconnect with the friends that you let go. Start to reconnect with parents or loved ones that are safe, that you can tell something to and they can listen and be very accepting. But start to join my community group. I got a free trial that I'm offering for 1 month. Normally it's $15 a month, but do something to increase your support base so that you get more validation, more places to sort of just vent, more, whatever you need to do that. Please do that. And the third thing that you can begin to do is and not always leaving as possible. I know we tell you to leave and we tell you to go no contact, but that's not always feasible, depending on your health, depending on your age, depending on your culture, depending on a whole lot of things, finances. The last thing you can do is begin to do what you can to improve your self-care. Often we end up being in these positions where we've let our own care go because they're so preoccupied, like hydration. Thank you for that. We've become so preoccupied with trying to manage them and the way that they're managing us that we stop taking care of ourselves. So just identify one small thing that you can do to improve your own health, whether it is hydration, maybe it's a focus on your sleep, maybe it's just having 15 minutes alone out on the porch or a quick walk around the block, but do something for yourself. Get a little more sunlight, get a little bit more water, do something that sort of says that you are important, that you matter, that you see yourself. That's one of the best things that you can do. All right, this is always great. You guys know I'm here every Tuesday at 4 p.m. Central Standard Time. I'm so excited to be here. Next week, we're going to be talking about why couples therapy is always a bad plan. So if you want to ask questions about therapy, maybe in general about what treatment looks like, what you should look for in a therapist, why couples therapy is a bad idea, we can get into all that type of topic next week. So next Tuesday, 4 p.m. Central Standard Time. Again, if you're looking for support, please reach out to me. I can point you into one of the directions of something I've got going. But this is lovely and so wonderful to hang out with you guys today. I deeply, deeply appreciate it. Thank you for letting me talk a lot today. I didn't take a lot of your questions, but let me talk a lot. And I'm so thrilled to be here. All right, I'll see you guys next week. Bye-bye.